I do appreciate everyone being here today to celebrate this really important milestone with us, and important not just for New Horizon Family Health Services, but for the community, because this is your community health center. As I stand before you today, I'm obviously very proud, but I can honestly say I am equally humbled as I reflect on the incredible journey that has led us here. Like the vast majority of our sister community health centers throughout South Carolina and throughout the nation, our beginnings were very modest. We started out on the 8th floor of the old General Hospital, which has been demolished some time ago. But that very property is the present-day location of our Mallet Street office, which until completion of this facility was actually our largest and main practice site. But let's start in the beginning. Lathrop already alluded to the fact of her involvement in getting the health center started, and this was back in the late 80s, where we had a group of community leaders and concerned citizens begin to organize and really look at this issue of why there were so many people in the community who simply lacked access to basic medical care that we all take for granted. Now understand, even back then in Greenville was considered a fairly resource-rich community. So if you had health insurance or financial means, there were many available options for health care. Those that were lacking access are those who are the very heart of every community. Here we're talking about your working class or your working poor. Although hardworking, tax-paying, productive members of society, a large proportion, just quite frankly, were uninsured, underinsured, or wages were so low that they could barely afford the necessities, let alone being able to pay for health care. In addition to that particular group, there was another group, and Lathrop has already mentioned, individuals in this community who actually had Medicaid coverage. Unfortunately, despite that coverage, they still had issues around access because there were either providers who were unwilling or unable, and Lathrop mentioned this early, to accept Medicaid, or the number of Medicaid patients that a particular practice would accept was fairly limited as well. So this is a situation that clearly illustrates that coverage does not always equal access. So that is another reason why this health center came into being during that time. The planning for this community health center emerged in response to the situation that existed in that time. It was based on the conviction that the working class, as human beings, are just as deserving of access to health care as everyone. They should not be relegated to the emergency room as their only option for health care. Community leaders, pioneers, and concerned citizens, including Ms. Lila Mae Brock, Dr. Ron Roulette, who's the former Health Department Director, Mr. Ralph Anderson, who was later Senator Ralph Anderson, Attorney Doug Brown, who has continued to be a strong friend and supporter over the years, Ms. Elaine Broderick, who is still today a member of our board, Mr. Eddie Sly, the Community Planning Council of the United Way, Greenville Health System, working with the South Carolina Primary Health Care Association, and other concerned citizens came together and said, no more. They planted the seeds, which sowed and cultivated over time, has led to a stronger health care delivery system and safety net in this community with New Horizon Family Health Services as an integral component. In 1992, when we actually started, we began life as Greenville Community Health Center, serving a few hundred patients with about 15 staff members. When I joined the organization in 1998, we were just completing construction of our first permanent home and full-time office on Mallet Street. We had about 40 employees serving around 7,000 people. Over time, we established various satellites throughout the community. Some were part-time operations, but we were trying our best to really get into those areas of the community where people had many challenges accessing health care. So over time, we established a small satellite at the Scott Towers Public Housing Facility for seniors, the Phyllis Wheatley Public Housing Apartments, the Golden Strip Family Development Center in the southern part of the county, and the Northwest Crescent Center in Berea. In 1999, through a collaboration with the former Slater Marietta Health and Human Services Agency, we acquired a small rural health center practice in the northern part of the county. That facility stands today as our Travelers Rest office, the result of a newly constructed 7,500 square foot facility in 2008. In 1999, we began a small part-time operation at the Greer Relief Center, or the J. Vernon Smith Center. Many of you know it by that name. Over time, we were able to relocate and expand that facility to our present-day 10,000 square foot practice in the eastern part of the county in the heart of Greer. In 1999, we established our Ryan White Part C program in collaboration with our partners, Aid Upstate, Greenville Health Systems, Infectious Disease Associates, and Upper Savannah Cares. This was a program that started out initially serving about 112 people who were impacted by HIV, had barely no access to health care. And I'm proud to say today, as a result of those partnerships and strong collaborations, we now serve nearly 1,200 people in 10 counties living with HIV disease. In 2002, in response to growing demand, we established an additional full-time site, our West End Medical Alliance office on Pendleton Street. In 2005, our Health Care for the Homeless program was established and began utilizing a mobile medical unit to provide medical care and related services to homeless people in 13 counties of the upstate. It is the only such program in this part of the state. In collaboration with homeless service providers and other agencies, this program now serves 2,000 homeless individuals each year. We began operation of our full-time New Horizon Family Dental Care Office and the mobile dental unit in 2006. By 2007, our organization had grown to serving about 15,000 people each year with over 100 employees and literally bursting at the seams, particularly at our Mallard Street office. So during our 2007 annual Strategic Planning Board retreat, based on the growing demand and the result of the community needs assessment, we determined we needed to start planning then for a larger facility in which expanded services could be provided. Early on in that process, as you've heard, we were fortunate enough to receive a generous donation of the land on which this facility is built from the Greenville Health System. And by November 2012, after much planning, much prayer, and much perseverance, we finally closed on the $16 million financing arrangement, thanks in large part to the Jobs Economic and Development Authority, or JADA, and Wells Fargo Bank. There have been many, many challenges along the way, as you can imagine, with a project of this magnitude. But again, thanks to planning, prayer, and perseverance, my constant companions during those times, we are proud to present to you today your new community health center and report the following. Today, through our practice transformation initiatives, we have deployed a sophisticated new electronic health record system to improve the quality of patient care as well as the patient experience. We have received NCQA Level 3 Patient-Centered Medical Home recognition at one of our sites and Level 2 recognition at several other sites. Over 80,000 medical, dental, and behavioral health visits are provided to more than 20,000 people at our 4 full-time sites, dental office, Health Care for the Homeless mobile unit, and mobile dental unit. Over 180,000 prescriptions are filled at all of our 4 full-time pharmacies. With the completion of this project, we have added an urgent care center, on-site radiology, and vastly expanded pharmacy services. Once fully operational, this facility would expand our capacity to serve an additional 10,000 people. Therefore, in total, we will be able to serve over 30,000 people in the community with more than 100,000 medical, dental, and behavioral health visits. And with that expansion, our pharmacy services, we will actually be able to complete more than 240,000 prescriptions annually. And you know, for our patient population, even if they are fortunate enough to be able to receive medical care, getting access to prescription drugs is often still very much a challenge. And that's why the expansion of our pharmacy services is so critically important. Further, we plan to expand behavioral health services, utilize telehealth, and dramatically expand partnerships to offer more on-site medical staff training opportunities. This is critically important, especially as we all know there's a shortage of primary care medical providers. So we want to provide that opportunity to attract and retain more medical providers in our community. Over the course of the next year, we will be adding another 50 positions to our staff for a total staffing of 250 employees organization-wide. Of those, 150 employees will actually be providing services from this facility. The facility will operate Monday through Saturday for a total of 84 hours each week. Now, we've already had patients showing up looking for that. We're going to get there over time, okay? We've just started providing services, but that is ultimately our plan. And then finally, in addition to the positive impact on the healthcare delivery system to which I've alluded, health centers are economic engines that contribute to local communities. A 2013 economic impact study performed by financial analyst company Capital Link determined New Horizon Family Health Services has a direct economic impact of nearly $16 million in 2013. Now, when you combine that with the indirect and induced impact associated with other industries through purchasing and related job stimulation, the total impact was over $27 million in this community. The estimated annual savings to our local, I think I cannot compete with that. Yeah. I'm competitive, but not that competitive, okay? But the estimated annual savings to the local healthcare delivery system is over $25 million. Now, that's based on 20,000 patients at $1,263 saved per patient served at this facility. One of our speakers mentioned earlier the cost of healthcare, and the cost of healthcare continues to escalate as it has for many years. So the fact that we're able to bring that value to our community, as do other community health centers, is extremely important. So as we become fully operational at this site, the projected direct impact or total operating expenditures will be in excess of $20 million. For a total combined future economic impact in this community due to the services of this health center of nearly $30 million of impact on the local economy. So going forward, we will continue to focus on a strong business model in order to ensure resources are available to further advance our mission in the future. We're extremely grateful for all of the support and assistance along the way, and we look forward to continued collaboration as we strive to help ensure access to quality health care for all people. Thank you.